Welcome to The Explainer. Today we're diving into a prescription medication called Prucalopride. See, this was designed to fix a really specific kind of system failure in our gut, one that your usual remedies often just can't touch. So let's get right into how it all works.
Okay, imagine your digestive system is this super complex, super efficient factory assembly line, right? It's always moving things along. But what happens when the main go signal, the one that starts everything, just gets stuck? Well, the whole production line just grinds to a halt. And this isn't just some little delay, It's a fundamental breakdown of the entire system.
So, this specific system failure we're talking about, it actually has a medical name. We are looking at chronic idiopathic constipation, or just CIC for short. And it's a condition that needs a way more targeted solution than anything you'd find over the counter.
So what exactly is CIC? Well, it's this long-term problem with bowel movements, but the real key word in its name is idiopathic. That's basically the medical way of saying we don't really know the exact cause. It means there's no obvious physical blockage, no disease we can point to. The system itself just isn't getting the right signals to do its job.
Yeah, a really good way to picture this is to think of the gut's internal communication network as being completely locked down. It's like the main office is sending out the "move it" signal over and over, but for whatever reason, that message just isn't getting received down on the factory floor.
So if the system is locked, the next question is pretty obvious, right? Where's the lock? To find it, scientists had to look deep inside the nervous system that lines our gut, a network so incredibly complex it's often called our second brain.
And they found it. The lock turns out to be a very, very specific type of protein. It's a receptor on the surface of nerve cells, and it's called the serotonin 5HT4 receptor. This tiny little protein is basically the master switch. When it gets activated, it kicks off this whole chain reaction that gets things moving again. In CIC, this lock is essentially stuck shut.
So if the problem is a lock, then the solution has got to be a key, right? And that brings us straight to Prucalopride. This medication was designed with literally one purpose in mind: to be the perfect key for that one specific lock.
Okay, now the scientific term for this is a selective, high-affinity 5HT4 receptor agonist. I know, that is a mouthful, but our little analogy makes it super simple. Selective and high affinity just mean it's a master key, designed to fit this one 5HT4 lock and pretty much nothing else. An agonist, that just means it doesn't just fit in the lock, it actually turns it and fires up the system.
So how does this key actually work when you take it? Well, it's a pretty neat four-step process. First, you take the pill, and the drug travels to the gut. Second, it finds and latches onto those 5HT4 receptors, our locks. Third, turning that lock releases these crucial chemical messengers. And fourth, those messengers tell the muscles in the colon wall to start their rhythmic, wave-like contractions. That's called peristalsis. And just like that, the system is unlocked and moving again.
Now that all sounds great in theory, but does this key actually work in the real world? This is where we need to stop looking at the mechanism and start looking at the clinical evidence.
And the major clinical trials show a really clear difference. Researchers looked at the percentage of patients who got back to what's considered normal bowel function. That's 3 or more complete movements a week. With a placebo, only about 12% of patients got there. But with Prucalopride, look at that, the number jumps to almost 31%. That is a huge, statistically significant improvement, and it confirms that yes, this key absolutely works.
But, just like any powerful tool, it is absolutely essential to read the instruction manual. Now that we know it works, we have to take a balanced look at the potential risks and the side effects. So the most common side effects that people report are pretty much what you might expect from a medication that's getting your gut moving again. Things like headache, some abdominal pain, nausea, and diarrhea.
And this is really important context. For a lot of people, these side effects are most noticeable on the very first day they take it. As their body gets used to the medication, they tend to fade away quite a bit over time.
And of course, there are some very important warnings to be aware of. Because serotonin receptors are also found in the brain, there's a serious warning to monitor for any changes in mood, like worsening depression or any suicidal thoughts. It's also not meant for people who have a physical blockage or severe inflammatory conditions like Crohn's. And the dose might need to be adjusted for folks with kidney issues.
Okay, so let's boil all this down to the key takeaways. First off, Prucalopride is a highly targeted treatment, specifically for CIC. Second, it works like a custom-made key, an agonist, for the gut's 5HT4 receptor lock, basically turning the whole system back on. Third, The clinical data is clear. It is significantly more effective than a placebo. And finally, it has a very well-documented profile of both common side effects and serious warnings that have to be considered by a doctor and their patient.
And that leaves us with a really fascinating final thought. Prucalopride is just a perfect example of targeting one tiny little component in the huge, complex network of our gut's second brain. So as we get better and better at mapping that system, you have to wonder what other conditions might be solved not with a sledgehammer, but with a perfectly crafted key. What's the next frontier for this kind of precision medicine going to be?
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.